Hello, my name is Dr. Dewan S. Raja. Today I will discuss about fetal alcohol syndrome. What is fetal alcohol syndrome? A syndrome of altered prenatal and postnatal growth and morphogenesis occurring in infants born of women who took alcohol during pregnancy. What is fetal alcohol spectrum disorder? This is the broad term. This includes the fetal alcohol syndrome, is used to refer to any alcohol-related defects. Fetal alcohol syndrome is the severe end of the fetal alcohol spectrum disorder. Necessary criteria for the diagnosis of fetal alcohol syndrome include what? Diminished growth, less than 10th percentile, diminished head circumference, less than 10th percentile, 2 of 3 facial features, short palpebral fissure. Palpebral fissure is the space between two eyelids. Smooth philtrum, the central depression on the upper lip. Here it is smooth. Here short palpebral fissure and thin upper lip. Upper lip is thin. In addition, there is cognitive disorder. There will be problem in judgment. So there will be lack of judgment capacity. There is some behavioral problem. There may be irregular behavior, maybe antisocial behavior, lack of adjustment, maybe some type of criminal behavior that is also possible. Okay, so there is some behavioral problem, judgment capacity problem, and other birth defect that may be some type of heart defect, that is ventricular septal defect, atrial septal defect, or phallostatology that may be possible. There may be abnormal development of the joints. Fetal alcohol syndrome. Okay, this is the feature. We look at the feature. There will be microcephaly. There may be holoprosencephaly, one ventricle in the forebrain, and narrow palpebral fissure, flat nose, short nose, and male development of the maxilla, and very thin upper lip, shallow philtrum, here shallow philtrum, okay, and certainly low IQ. Okay, this is the number one cause of mental retardation in the United States of America. There may be behavioral problem, there may be cognitive problem. So we have another term, alcohol-related neurodevelopmental disorder, ARND, involvement of CNS, that is brain and spinal cord, that does not meet the diagnostic criteria of fetal alcohol syndrome. Like here, we'll get holoprosencephaly, intellectual disability, behavioral problem. Okay, you must remember that maternal alcoholism is the number one cause of preventable mental retardation. How much alcohol is necessary to cause fetal alcohol syndrome? Not clear. Okay, that is not clear. There is some criteria fed by the American Psychological Association. Okay, but that may not be applicable to everyone. Dose and stage of pregnancy are very much important. Higher dose of alcohol during pregnancy, more chance to get fetal alcohol syndrome. Okay, less will cause most likely less complication of fetal alcohol syndrome, or may not be any fetal alcohol syndrome. Stage of pregnancy is very important. First trimester of pregnancy is very critical. Okay, during the time of embryogenesis, alcohol intake during that time is a huge problem. It may lead to fetal alcohol syndrome. Binge drinking during first trimester of pregnancy, maybe more than 4 or 5 drinks in 24 hours, may cause fetal alcohol syndrome with cleft palate. Okay, so we got some of the feature of the brain. This is the holoprosencephaly. We should have 2 ventricles. Here we're getting one opening, one ventricle, that is the holoprosencephaly. Okay, here again getting the flattened nose and the narrow palpebral fissure, maldevelopment of the maxilla, thin upper lip, shallow philtrum, low IQ. There may be congenital heart defect. There may be problem in the digits or finger. There may be some defective joints. Pathogenesis. Alcoholism is a teratogen. Alcohol can cross the placental barrier and accumulate in the embryo and fetus. Fetal liver has insufficient enzyme like that of the dehydrogenase to metabolize alcohol. This is the recent theory, okay? That is, alcohol downregulates sonic hedgehog SHS signaling through interference with SHS binding to cholesterol. This downregulation results in abnormal brain development and death of neural crash cells, which are essential for the development of the head and neck. Okay. Incidence and prevention. Incidence of fetal alcohol syndrome is estimated to be 2 to 9 infants per 1,000 births. It varies from country to country, from person to person. Incidence of fetal alcohol spectrum disorder 24 to 48 infants per 1,000 births. Again, that is depending on the location. Some country people don't consume alcohol. They have less chance or no chance to get fetal alcohol syndrome. Public health burden of the USA approximately $6 to $8 billion per year to manage this mentally retarded babies or persons. Also, not only mental retardation, physical disability also, like that of maybe congenital heart defect. There may be facial abnormality, okay, plus joint abnormality, okay. So, and also behavioral and cognitive dysfunction. So this may cost 6 to 8 billion per year in the United States. Is it preventable? Yes, it is. No alcohol during pregnancy means no fetal alcohol spectrum disorder. What is the health education? No alcohol throughout the pregnancy. Well, first trimester of pregnancy is very critical during embryogenesis, but brain develops throughout pregnancy. So anytime during pregnancy taking alcohol may cause brain damage, mental retardation. No alcohol if a woman intends to become pregnant. Sometimes women become pregnant without their knowledge. Okay, they may have alcohol that they took during the first trimester. They may realize they are pregnant 1 or 2 months later. Okay, that may happen. Okay, and that's all about the fetal alcohol syndrome and fetal alcohol spectrum disorder. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me and have a nice day. Bye now.